So today I'm going to discuss something which is very important for pregnant women, and then of course subsequently I will also discuss something which will be important for women who want to conceive. For those who are already pregnant, there is always a fear of what is called gestational diabetes. I alluded to this gestational diabetes when I spoke about the types of diabetes. This is a diabetes or rise in sugars that happens in the third trimester of pregnancy. That means after the 20th week of pregnancy. And this is typically because of the certain changes that occur in the body of a pregnant woman. Now, the fear is not for the woman. The fear is that this elevated sugar will go to the baby, and the baby tends to either become very fat, or in certain cases, if the sugars are very high, the growth can even reduce. But most of the times, the baby becomes fat. There is difficulty in delivery. The baby may develop difficulty in breathing after delivery, or there is very high jaundice after delivery. And on a more important note, such babies always have a higher chance of developing diabetes in adult life. So we do not want the sugars in the woman to be high. What do we do? So testing will always be advised by a gynecologist, and we try and keep the sugars to fasting below 95 and after meals to say approximately 120 to 130. And how do we do that? Diet is very important, and this has a very important cultural base, because in India particularly, pregnant women are often pampered by their mother-in-law or the mother, and they keep feeding this woman saying that aapko zyada lagega, you are pregnant, you will need more food, etc. And a lot of sweets and rich items are given. This is not necessarily very correct. So a diet consultation is always very important for such women, and we try and reduce the carbohydrates a little bit. And if that does not alone work, we can use certain drugs and even insulin to keep the sugars normal. Most of the times, once the baby has delivered, sugars quickly come back to normal. But remember that this is not all over, because diabetes which has occurred in pregnancy may come back after several years if adequate care is not taken.